I'm supposed to do live stream myself.
We are unable to go live, so I was just checking with
Just give me a minute. I'm doing it now.
Fine. Dr. Rupa is trying. You have to.
Yeah.
Yeah. Yeah. You have to.
Dr. Rupa?
Can you
Yes.
hear?
Everything is okay. It started already.
It started, Satakshi.
Okay.
So, hello everyone. Can you all hear me? This is a live session. We'll wait for a few minutes for everyone to join. So, this is a question answer session, and we are here right now. I was waiting for Dr. Anuradha to join in. If she is here, she will join. Otherwise, I'm here, and we can answer your questions. We'll wait till 20 minutes. You all stay on. And if you all have any questions, we will answer. So I'm waiting if she can join. Otherwise, we will answer some of your questions. Someone had asked about the yeast in the earlier session. So let me tell you that, of course, the vegans do use, yeast. There is no problem. We definitely use yeast, and it is considered as vegan. Okay. So that was one question. Then someone had asked the question about how to, live on a whole food plant-based diet with very little expenses. So I wanted to answer on that as well. That roti, sabji, dal, chawal, these are vegan. A little bit of salad, onion. Our poor people in India just eat maybe lots of rice, a little bit of sometimes dal, a little bit of vegetables, and sometimes there is onion, there is red chili, and this is their food. Poor people can't really afford milk products, or they cannot afford also the meat or eggs or fish all the time. So they are mostly eating plant-based diet, or they have lots of chapati. People in the north have lots of chapatis and maybe a little bit of sabji and like dal. So to think that we need dairy products, or to think that we need meat products is not correct, because there are loads of us who are eating mostly plant-based diet and are also very strong. So that was a question, that these foods are available quite cheaply in our country, and so we can definitely live on a plant-based diet with very less money. So that was another question. Since Dr. Anuradha is right now not over here, I will not be able to answer the question about the eye surgeons finding benefits in any of the eye conditions. But let me tell you also, I have found in my type 2 diabetes patients, when they go on a plant-based diet, particularly the whole food plant-based diet, I find that their changes in the retina, the diabetic retinopathy definitely improves. Their vision improves. If it's a very new case, like just 1 or 2 years old, and they have developed some retinopathy, then there is a very good chance that these symptoms will reverse. So that was another one. But also, make sure, oh yeah, there Dr. Anuradha is right over here. Dr. Anuradha, I'm waiting for you. And there was a question whether you would like to answer about. Hello, Dr. Anuradha. Welcome, welcome. Everybody heard you in the earlier session about your vegan journey. And there were a few questions that I thought, we can cover right now. So Anuradha is just out of her very busy OT schedule today, but because I just said, Anuradha, you have to be here for a few minutes and just say hello to everyone. There was a question if you have kind of got any experiences about whole food
Ma'am, your voice just got cut. Has the question been?
diet in any of the eye conditions so far? Have you recommended?
This is an excellent question, ma'am. The thing is, I came to know sort of about the power of whole food plant-based
All
diet
right. Yes.
here.
Yeah,
Ma'am, can I continue?
okay. May I repeat the question? Yeah, or eye conditions. Any experiences?
Ma'am, because I'm an ophthalmic plastic surgeon, I often get patients who have orbital inflammatory disease, which is a form of an autoimmune disease in which you have repeated inflammations of various structures, which is around the eye. I'll give you an example, like a lacrimal gland inflammation is the most common among those. So it's quite common in middle-aged women. They have recurrent attacks of swelling of the lacrimal gland with swelling, pain, etc. So I did have a few patients who every 3 to 6 months they would have these attacks, and I had to put them on long-term steroids, immunosuppressants. So two of those patients, I sort of convinced them to, both were vegetarian. I convinced them to sort of give up dairy, and I would say that one patient since 8 months, she has shown no recurrence of inflammation, and the other patient hasn't come to me for 6 months, which is a bit of a surprise. And I'm really happy with that change. And so since I started giving this advice relatively recently, since a year, because like we had discussed, I'm more of an ethical vegan and the health aspect was something new for me as well. So I would say it's beginning, but then every patient of mine that I see with a lot of dry eye, I get a patients with a lot of eyelid issues as well, wherein the glands in the oil are not functioning properly. And I have found that shifting to a whole food diet, which is rich in antioxidants, low in fat, tends to sort of enhance the functioning of the glands and tends to cause lesser of those problems. So yeah, I think it makes a big difference, apart from, of course, weight loss and general maintenance of health as well.
Wonderful. May I request Nandita to read the questions on the chat section, because I just saw people are sharing a lot of comments and sections.
Yes, sure.
Yeah, if you can ask.
Moment.
Yeah. So, Anuradha, there were lots of people this morning who were watching the session.
Oh, wow.
Yes.
All content is very unique and who is following particularly. Yes, Nandita, please go on with the questions.
Can you hear me?
Yes, yes, we can hear you.
Okay. The first question is from was during the session was from Monica A. She says that she was vegan for the last 4 years. How can I not eat cookies?
Is that question for me or Dr. Rupa?
This is a general question.
Okay. So regarding cookies, I'll let you know that I have a massive, massive sweet tooth, like I already discussed. And there are enough options in the market. All you need to do is read the fine print and the label. So I'll give you an example, like hide and seek biscuits are vegan, and yeah, they are. It's not very healthy, I agree, but then once in a while, indulgence is great. So there is a long list of biscuits and even cookies which are vegan. So it has to be a habit to read the fine print of everything that you buy. So once you adopt that habit, initially it might seem a little cumbersome, but down the line you will already know which brands have. That apart, there are simple recipes with hardly 4-5 ingredients of vegan cookies that you can prepare at home in a matter of half an hour or less online. And apart from that, within the community, you'll see a lot of chefs who prepare amazing desserts, cakes, cookies, etc., from whom you can order if you're lazy to cook like me. So I don't think cookies is a problem at all. I'm not missing out anything.
Okay. All right. Thanks. The next question is from Neeru Gupta. What is the alternative for morning tea for which it's very habitual?
Morning tea, I'm more of a coffee drinker. I suddenly shifted to black coffee and I found that the flavor of black coffee is far better and more intense when you have it black. And I would say same for tea. I think if you really want the taste of tea, black would be best. Milk actually dilutes the flavor. That apart, if you really want to have milk tea, there are numerous options. Like people have various preferences. The vegan community says that oat milk is best for making tea, but there are people who prefer it with almond milk, cashew milk. It's a matter of experimenting and figuring out what you like. But I highly recommend going black personally.
Okay. Okay. The next question was from Samiksha, who thinks that ghee is absolutely essential in her food. So how would you respond to that?
I think the best person to answer this question is right on screen, Dr. Rupa ma'am. It's very, very important for you to do all the talks based on dairy. If dairy is harmful, then something which is a condensed form of dairy, which is ghee, how can that be pure? It's a simple question, right?
Yes.
So, yeah, I would suggest you should listen to Rupa ma'am and hear the talks on dairy before finally taking a call on whether to exclude it from your diet or not. And apart from that, we practice evidence-based medicine. And till date, I do not think there has been a single paper on benefits of ghee in any peer-reviewed journal.
All right. The next question is that have you experienced any reversal of cataract or any improvement in cataract with a change to a plant-based diet?
Good question. Firstly, age-associated cataract is not a disease. So that concept has to be changed. Just like your hair whitens, and that's not considered a disease, right? When you're 60, 70, or even earlier nowadays. So age-associated cataract is just a change in the protein structure of the lens. It is not a disease. And aging cannot be reversed. It can be slowed. That's it. Now, the cataract, there are certain cataracts which come in early. They are associated with diabetes, for example. Diabetes or chronic uveitic conditions, which is a sort of inflammation in the eye. When you have these conditions, diabetes can happen early. So if you control these diseases, autoimmune diseases, if you control diabetes systemically, there are chances you will not develop a cataract due to this early on. So that is where again plant food can help you. So yeah, you can reverse disease-associated cataract with it. Not reverse, I would say slow down the onset or even prevent it. But aging-associated cataract, you cannot. It's simple. It's a normal aging process. You have to accept it.
So can an operation be avoided for someone on a plant-based diet?
What sort of operation? Are you talking about cataract operation?
Yes. Yes. To replace.
Well-developed cataract will not change because it is chemistry. It is basically protein change, right? The proteins in the lens have become opaque. So that change cannot be reversed. It is irreversible. An existing cataract has to be repaired. And to be honest, if you have age-related cataract, that should not be a motivation for you to change into a whole food plant-based diet. It has far numerous advantages, and cataract surgery is very safe, done with micro-incisions nowadays. The surgeons are highly trained and precise. So I would say of all the surgeries, cataract surgery has a very high safety profile. And yeah, that's all.
Okay. And what about cataract that's triggered because of diabetes? If the diabetes is reversed on a plant-based diet, can that be reversed?
With certain diabetics, the proteins, the water content in the lens increases and causes certain changes. So that part of it, when the sugars are in control, can be reversed. So in diabetes, when diabetes is not in control, you might notice doctors do not even give prescription glasses because the hydration level of the lens varies and it changes the refraction constantly with your sugar levels going up and down. So that thing can be controlled. But the cataract, once it has completely formed, it cannot be removed because it is an irreversible change in the protein structure.
Okay.
The thing would be to control cataract early on. And in diabetes, the cataract that forms tends to affect vision much earlier than other forms of cataract.
Okay.
Best thing would be to sort of control your diabetes so that the cataract doesn't form. But if it has formed, it is a good idea to go ahead, have surgery, as well as change your diet so that at least your retina is safe and your body systems and organs are safe.
Okay. Okay. Thank you. Those are all the questions on the chat.
Thank you.
Yeah. Thank you.
Thank you, Nandita.
Yeah.
So, Anuradha,
Yes, ma'am.
it, everyone is very surprised to see that there are, doctors now talking about plant-based diet. And how come, like, they have not heard about all this from the mainstream doctors? And when will they start talking about the same thing that you and I are talking?
Ma'am, I think right now, the very fact that we have YouTube, Netflix on our hands, right? That itself makes a big difference in dissemination of information. Like internet could be used in good ways and bad ways. So if you're sticking to the good ways, it's a great tool to learn about anything, about art, about knowledge. So when information is out there and you come across it, it did surprise me as well. And one of the factors is what many of the vegan doctors and plant-based doctors have been saying. The medical curriculum does not include nutrition. We are not taught food. And it's ridiculous because food is the building block of our body. Food is what makes us breathe, makes us walk, makes us talk, everything basically. We are composed of what we eat. And the very fact that this is not included in the medical curriculum means that there's something murky going on in the background. And I think the movie What the Health on Netflix sort of opened my eyes regarding why that reason could be. In the US also, there initial days there has been a lot of opposition from including nutrition studies and trials in the medical curriculum. This is because of a sort of a capitalistic mentality that has come in and corporate greed that seeps into the animal industry, which tends to um, sustain economy in society. And it is believed that if these industries break down, the whole economy of the country can go down. So a combination of this nexus, corporate greed, with deceptive marketing, funding of various medical and research associations from many of these industries, all of that play a role in the curriculum. And that is the reason why including the American Diabetes Cancer Association, they themselves advise bacon and beef in recommended diets, which is, we all know how wrong that is. It's a problem which is far deeper than we think it is.
Okay. There's a question from Anjana. She's asking, what is your opinion on sun gazing?
On?
Sun gazing.
I would say don't do it. Don't do it. It's as simple as that. Haven't we heard of enough macular burns, especially during solar eclipses? So not only sun gazing, if somebody is welding, I would suggest avoid looking at that. All of these can cause certain burns in the retina, and these burns can be irreversible and they can render you decrease vision or even render you blind for life. So do not try anything the eye doctor hasn't recommended.
All right. Understood. Noted. Thank you.
Also, what is the way forward in this pandemic? If we have some suggestions, that would be very nice, because people are very confused about the entire disease that we know now has come from animals and more can come. What is the way forward and how do we look after ourselves in this pandemic times?
2020, in 2020 has been a very, very interesting year. And I think if we do not emerge out of it, if we emerge out of it unchanged, it would be extremely foolish of all of us. So if there is a house,
Absolutely true. I totally agree with you.
if there's a house that is burning, right? Are you going to keep putting petrol and kerosene there, or are you going to put water? So right now, I would say the entire planet and the way human society is structured is such that these sort of pandemics are going to become routine. So looking at vaccine and the development of it and pushing your entire force and attention there, it's quite foolish is what I feel, because you're trying to catch hold of one. It's like everybody has guns in the country, and you're catching hold of one person who's using the gun, but everybody has a gun in their house. So it's not going to change the situation. So I think it's very important that we realize what gave birth, the conditions that gave birth to this vaccine, rather than pointing fingers at a wet market, at China. It's important to introspect and look at the sort of life that we have been living in the name of culture and tradition. Because remember, I mean, women were looked as second citizens once upon a time. That was normal. Child marriage was considered normal. Sati was considered normal. But we do not continue those in the name of tradition and culture. So I think we should think about how we are exploiting animals and nature to for our selfish purposes, when there are enough options outside which are environmentally better, which are better health wise, which are better for everyone else. Because right now, what we eat, what we wear, they are no longer personal choices. When coronavirus has been created by somebody buying some pig or bat meat in China, and it has affected the whole country. So don't be ignorant. Don't be a person who doesn't care enough. That's very important, and that's what I'm afraid of, that people may not get that they can continue to be as uncaring and unempathetic and irresponsible.
So Anuradha is mentioning about, living a compassionate way of living, being very sensitive, being aware, take on the responsibility. Just because you drink, say, milk, you think, you don't kill cow, but a cow suffers completely. You just have to go to a dairy farm to go and check out that you become party to cause that suffering. Plus, there are health hazards of eating dairy products. So, compassion goes all the way into what we eat, what we air, what we wear, what we use as products. Wherever there is animal exploitation, and we, start using them for our purpose recklessly, we are going to disturb the balance on this planet. All animals are here for their own purpose, and we are here for our own purpose. But if we start encroaching each other's spaces, it's going to um, become an end for all of us, actually.
And being in denial, being egoistic, this is not the time for all that.
Absolutely not, and nothing happens by mistake or chance. All of there is a sequence. There's a story. There was a pandemic that was in the happening all the time, and there are also these bigger pandemics like heart disease, diabetes, obesity. They've been there for years, affecting huge number of population.
That is what is ridiculous and frustrating, is that when you're sitting with a group of non-vegans, they're commenting on your plate when your plate is full of compassion and empathy and health, and also protects the environment. So don't transpose guilt. Rather, you look at things with an unbiased, unegoistic manner and try to learn and try to ask, why are these people choosing this path? Is there something that I'm missing out on? Because the evidence is out there. It is glaring in front of us.
Absolutely. Look at this eye surgeons. I can't even pronounce their specialty properly. Oncoretino surgeon or something. And many plastic surgery and many other specialty. But they are all talking. They are all giving the message of compassion. They are telling us this is the way forward. The best of the world is at their feet with all their knowledge, and yet they decide to go compassionate way, ahimsa way, and the vegan way. So, all the viewers here, this is the message from the three eye surgeons, but there were also some more three eye surgeons whom we didn't include in this as they were very busy to come for the session. Someday we will hear them as well. And from 3 plus 3, 6, someday it will be 600 and maybe 6,000 of all the eye surgeons who will become vegan. But that's just one of it. All the doctors will also start choosing the same path very soon. As soon as our community becomes bigger, we all speak the same language. So that was the purpose today. Thank you very much, Anuradha, for taking out time to talk to our audience today, and we'll see you again in future for many of our events.
Thank you so much. I'm really honored to be part of this, and hats off to you for arranging these 3 days. And thank you so much. I'm
All
really
right.
thank you.
Thanks. Bye.